Welcome to Undiet Your Coaching Practice podcast. I'm Stephanie Dozier, clinical nutritionist, certified intuitive eating counselor, and creator of the Going to Beyond the Food method. And after a 25-year dieting career, I decided to say hell no to diet culture and undiet my life, which also included my coaching practice. I'm on a mission to help all coaches undiet not only their life, but their coaching business. If you want to throw down diet culture, you're in the right place. Ready, sisters? Let's do this. Hello, my dear colleagues. I'm so excited to be with you and to kick off season 4 of Undiet Your Coaching Practice podcast with a brand new series of episodes. And I have so much to share with you. I can barely contain myself. But before we get into the detail of season 4, I wanted to highlight the launch of our scholarship. So both of our business, Undiet Your Coaching Practice and Undiet Your Life, which is our consumer business, have come together and committed to doing our part in making the non-diet and the anti-diet industry more inclusive and accessible to fat, Black, Indigenous, and people of color. Because we need a hell of a lot more coaches representing these groups more than ever. So we launched last Tuesday our brand new scholarship. It's actually 2 scholarships that will be attributed to one self-identified fat coach or health practitioner, and one that will be attributed to a BIPOC self-identified coach or practitioner that are wanting to grow their non-diet business. These scholarships are to be used for our non-diet mentorship program, which has 2 groups yearly that take a 6-month training, both non-diet professional skills and then the non-diet business building approach that we teach in that program. So people selected for the scholarship will be able to apply it to the non-diet mentorship program that will start in January 2022. So we've put the link to the scholarship in the show notes. So please go and visit it. You have until October 30th, 2021 to apply. And if this is not for you, meaning you are not fat, Black, Indigenous, or a person of color, but you know someone that is, pass this information on to them. I really want to help bring more people in our industry that can help be more inclusive and diverse. So on to season 4 of our podcast. We're going to start doing more interview because I want to introduce you to people that are in my inner circle. So colleagues that I mastermind with, people that work in my business, collaborator, contractor, people that help me get to the place where I am today. We're going to also have panel conversation. I have never done this before, but I know we need it. We need to talk collectively in debates on topics that are unique to our industry and controversial topic that people think about, but everyone is afraid to bring the conversation forward. So this podcast is going to be hosting in the next 2 months, 2 of those panel conversations. And we're also going to bring people to help us with our building business skill in a ethical and inclusive way. So you're going to hear me talk a lot about ethical marketing, feminist building business skills. And also I'm going to bring on people that can help us with our professional skills because our industry lacks severely training that is specifically created for us. So I'm going to bring on people that have either taught me or that I look up to for certain part of my professional skills, and they're going to come and teach us on this podcast. And today is one of those episodes. Today, we're going to welcome Dr. Maggie Landis. I met Maggie a year and a half ago. She was a student in one of my professional training, and she's a board certified physician, public health nutritionist, and practice with an anti-diet lens. And I wanted to have her on a podcast so we can learn how to navigate the medical care team relationship as a coach, how to coach our client through difficult situation because of weight stigma. I mean, it's out there. How do we coach our client pre-visit and post-visit that may have been a difficult visit? And I wanted to have the other side, right? The other party involved in this, which is a doctor. So Maggie's going to come and teach us how we can coach our client. She has a 3-step system that she's going to teach us. We're going to talk a lot about consent because I don't think it's talked about enough in our industry. And that's the part that we can educate our clients and patients on, is this notion of consent between them and their medical team. So with that in mind, I've talked enough. We're going to go and move on to the interview with Maggie. Welcome to the show, Maggie.
Well, thank you, Steph, for having me.
It's a conversation I've been excited to have. You were on my list of people that I wanted to have a conversation with because I think this conversation between two colleagues are going to help hundreds of coaches out there help people.
I hope so. That's the idea.
Yeah. So let's get right into the topic at hand. I brought you on because you are a physician. You have gone through the training of a physician. You've practiced. And you understand from the inside in weight stigma in healthcare.
Yeah, which is a huge issue, as you know.
Yeah. So just for background purposes, like where does it come from? Like where do you as a collective of physicians are trained, indoctrinated, socialized to stigmatize patients based on their weight?
Well, I don't know why sort of the nutrition science that's taught in medical school. And let me say, as a side note, it's very limited, but the stuff that's taught, it's very antiquated. It's almost like we know that science evolves, right? And there's always new information coming and new research. And we accept that in every other discipline. Like we use new medication, we use new surgical techniques, we use new things. But for some reason, we hang on to these ideas about nutrition and food and weight from truly decades and centuries ago. And it's kind of accepted like biblical truth. Like there's no way it can ever change. And so that's what gets put in the textbooks. That's what gets put in the curriculum. And, to be honest, when you're in school learning that volume of material, you don't have the time to stop and kind of question everything, right? So when some professor dude in the front of the classroom with a bow tie and like white hair tells you that fat people are less healthy, you kind of just say, okay, and you keep going because there's no, it wasn't until after I really scrutinized the literature that I realized, well, that's not absolutely true. But at the moment, we're kind of caught up in this I don't know what the word is, but it is truly like we just hang on to this very outdated, totally not evidence-based thing. And then the problem on top of that, so the education is inadequate and we're just people. So then you have a bunch of doctors who are influenced personally by diet culture, learning in an education that is, weight stigmatizing and diet culture influenced. And you drop them into a practice environment, which is also broken and diet culture influenced. And no wonder it's gone off the rails, right? I mean, there's no way that's going to work well.
Well, or that's the perfect environment for weight stigma to perpetuate itself in medical care, because from every angle, it's reinforced that it's the truth.
Yeah, it's reinforced. And it's not even that most physicians are not aware of the, health at every size literature and all the data about weight stigma and health outcomes. Not only do they not know how to make it better, they're actually making it worse. And
so what you're saying, they're not trained on the side effect, or they're not informed on the side effect of weight stigma, or weight stigma at all is not a topic of training.
Oh, no. Well, and I can tell you with certainty. Okay. Now I went to medical school over 20 years ago, but I have a graduate degree in nutrition, which I just got in the last 4 years.
After the medical degree.
Correct. And I will tell you that even in that training, which is more current, I mean, weight stigma, that wasn't even a word. Like that wasn't even a vocabulary word in any of the teaching. So I don't think I'm the outdated one. I don't think it's like, well, she went to medical school a long time ago. It's different. I don't think it's that different. Now, the fact I have heard some more junior physicians, like they just maybe broach the idea of inclusivity, and it's sort of like even a tiny topic of conversation, then I think that's a win, but that's not enough for me. That's not satisfactory. I mean, that's not, of course, that we need way more change than one line in one book in one medical school.
So for a physician, and we're talking physician, but we're talking also registered nurse and PAs and all the variation of a medical team, for physician to be inclusive in their practice and to provide healthcare that's not stigmatizing. It's a personal effort that they've made on the side to go and get informed, trained, educated on, and then bring that back in their practice.
Correct. And that's why there's so few. I mean, like I'm the outlier, I'm not the normative model of clinical practice, because this is not the normal mainstream narrative in clinical medicine, which is really unfortunate, because it's actually, and I know, this is where the evidence is. I mean, the evidence supports a inclusive model. The evidence supports that weight and health are not as tightly coupled as we have believed they are, and this health at every size and weight inclusivity model of care is better for patients. It's still not kind of the norm. So
just out of curiosity, when I went to nutrition school, I was the person in the room in the larger body. So in a weight stigmatized educational environment, it must be all straight size bodied people or very few people in larger body.
Well, I think there is some bias in that, because I think a lot of people, to be honest, now I don't know about being a doctor, but I can say with pretty good certainty, going to be a registered dietitian and going to nutrition school, a lot of people pick that profession because of their own history of disordered eating, because they feel like, well, I did so, quote, great managing my own food and body. I want to go be a professional and be paid to do this for other people that need my help. And so that's interesting, because I had a conversation with somebody one time, and I really do think, I'd have to look to make sure this is true, but there's a higher incidence of disordered eating and eating disorders in people in this profession than there is at the population at large.
In the field of nutrition, I have stats on that. It's 71%.
That's 71%?
71%. And that was a study done in 19 countries based out of Australia. 71% of students demonstrated disordered eating symptoms.
Well, I believe it, because we have this perfectionistic idea that, we learn a little bit. And this is the trouble with diet culture, is it starts with like a teeny tiny morsel of truth. It's most of it is not fabricated out of thin air. Most of it is like, we say, okay, so like, yes, omega-3s are less inflammatory than omega-6s. And then we do some study on a rat and we figure this out. And then all of a sudden we can't eat any foods that have omega-6 fats in them. And we start getting crazy. Like we double down on something taken way out of context. And it's kind of like the dietitians and the doctors of the world are like just smart enough to make that dangerous, because they do know enough. Like it starts with something that is slightly true in another setting and then is like wildfire. And
it's weight stigma is that, right? There is some risk associated, but it's not the cause, but we narratively put it out into the world that weight is the cause of disease, when in fact, that's not what the research says at all. We just exponentially blow it out of proportion.
Right. And everybody likes to, simplify everything, because medicine is complicated. Human physiology is complicated. Nutrition is complicated. So the more simplistic we feel like we can make it, makes it easier. I mean, it's just easier to talk about. It's easier to practice. So we get this, idea that your weight is in your control. And if you're not controlling it, your health is not good. And then we take that, which none of that's true. Those are all sort of false beliefs. And we just put that on the patients totally across the board. And I make a big point too, that we miss an opportunity for the conversations we should be having, because that's really what weight stigma does in healthcare is, besides just sort of generally not being nice, I mean, it distracts from the conversation we can have about health promoting behaviors and actual risk, because we're so sidelined by this fixation on body size.
Is that linked to the BMI?
Oh, Lord.
How you guys are taught BMI and how to use it?
Well, yeah. And I don't know. So I know you're in Canada, and I don't know exactly how it works when you go see your doctor. But if you go to a doctor in the United States, most of the time you go from the waiting room to you walk down the hallway where the exam rooms are, and the scale is like in the hallway.
Absolutely.
So it's the first point of contact. You don't even talk to the doctor or anything. Some MA or nurse or something weighs you, types it in the computer, which prints, of course, like this big, it's either red or green or yellow, depending on your BMI and how you're categorized. And that frames the whole encounter before it's even started. It doesn't even matter what you're there for. If you're there for a headache or stomach ache or a diarrhea or what, it doesn't matter. It's just like this weight is the red carpet that is like rolled out to invite the conversation. And it's wrong. I mean, it's just wrong.
Is that how they're trained? Is that why they do it? Because that's how you're trained to structure your consultation?
Yeah, basically, yes. And a lot of this really has been emphasized since the 90s, when wasn't it the late 90s, when they basically voted the governing bodies that, quote, obesity is a disease.
Yes.
And that's what was like punctuated the behavior, because, it was sort of like, well, maybe we should be talking about this. Maybe we shouldn't. I don't know. Maybe it's their fault. Maybe it's not their fault, but when they said, oh, this is a disease and you are a physician and you're responsible for treating disease and preventing disease, I mean, that's like just put it at the center of everything. I mean, that to me is what really sort of put the nail in the coffin with this weight stigma, because now, I mean, it's on your list of diagnoses. Like the computer does it. You're like, if the nurse types in your weight and the computer calculates your BMI, and your BMI is in the, quote, overweight or obese range or whatever, that is now a diagnosis code that follows you on your medical record. It's at the top of the list. And it gets equal attention as everything else on the list. And I think that's wrong.
So let's talk about that relationship of power, because that's how I coach clients and coaches, is in the relationship between patients and, call it, physician, or that PA or whoever they seeing that whole, the provider. Yes, use the term provider. Between the patient and the provider, many patients have been socially trained that the physician or the provider holds the power in a relationship, and they have no choice but to obey, tolerate, and holds the conversation or have the conversation that the provider wants to have, aka talk about their weight. Is that true, that we must, as patients, have this conversation even though we don't want to have it?
Well, no, it's not. And essentially we practice under a model of informed consent. All right. And here's the interesting thing to me. I will get to the answer to that question, but patients have no problem refusing all kinds of stuff in the doctor's office all the time. Trust me. They refuse surgery. They refuse blood products. They refuse vaccines. They refuse tests and radiology studies and all kinds of things with no hesitation. But they feel like this getting weight on the scale and spending the whole appointment talking about it, it's compulsory. Like they don't think that is something you have to kind of consent to, and it's a little soft because it's not a needle and a test. So it's hard to recognize that you can say no. And you're absolutely right. There is a power differential in that exam room. And the provider should be respected. I mean, we didn't go to school for like 1,000 years to not know anything. Like most providers are extremely good at what they do, but the patient-centered care still has to revolve around what the patient wants to get out of this appointment. You know what I'm saying? It's the patient's agenda that should drive the conversation. Even if the doctor's leading the conversation, we're talking like you got 10 minutes, 15 minutes, maybe if you're lucky. So we got to get to work here. We can't spend all this time prancing around this, distraction. So it is hard. And I realize it's hard. And I'll tell you what, I'm a doctor and I'm in a, quote, overweight body. And when I go to the doctor, I even have trouble telling another doctor, like, I'm not talking about this today. Like, this is not why I'm here. I don't think this is relevant to my current complaint, and I know that if I'm that uncomfortable, the people who don't have the level of background that I have in that environment are absolutely not comfortable, but there is a way, I will tell you, and this is what I like to teach people to do, is how to readjust the conversation, how to sort of take control of the conversation. But the first step is knowing that that it is permissible to do that. And as far as I'm concerned, that's basically part of the informed consent model, is that to be weighed and spend all this time talking about your weight has to be mutually consensual, if I can say it like that. And I sort of use 3 different things. All right. Because people have a different comfort level. It's different if you're a brand new patient, or it's different if this is the doctor you've seen for 20 years. This is different if you're there for acne or if you're there for cancer. I mean, there's differences, right? So there's a lot of nuance to this. And I sort of tell people they have 3 choices. Okay. Number 1, you can just get out. I mean, if it is so uncomfortable and punishing, you don't even have to, finish that visit. I mean, you really, truly can. Now, most people are not going to they usually have to wait to get an appointment and all this sort of stuff. So they're going to do this. But the next step is to kind of truncate the conversation, like end the conversation. So one good way to do this without being disrespectful to the physician, it's not the right place, because I'll tell you what, doctors get very irritated with patients that kind of fight back in a disrespectful way. Okay. And we just don't like being told that we don't know what we're doing. And that part of that is arrogance. Part of that is we really do have a lot of knowledge, and to totally discredit that is a little offensive. And there's a lot of reasons, whatever it is. But, you can say something as simple as, I hear your concern, but I'm actually here today to talk about sinus infection. So I don't think this is really relevant. What you can say in the hallway when the nurse is dragging you to the scale is, you can say, I don't think my weight is relevant to my care today, or I'd like to wait till I talk to the doctor to discuss whether or not there's a benefit to me being weighed today, or, no thanks, or I'd like whatever. And let me just tell you what, you'll be surprised, because when I tell people to do this and they're, oh gosh, I don't know, that seems really confrontational and aggressive. 99 out of 100 times, the other person could care less. Like, let me tell you what, the MA making $8 an hour, dragging you down the hallway, honestly could care less. They just want to put you in the room like they were told to do, and whatever. If you say no, they say fine, and they put some little mark, and if you say, I want to wait till I talk to the doctor, chances are by the time you actually talk to the doctor and the visit is on a roll and you're getting into your conversation and the time is going by, they're not going to drag you back out in the hallway to the scale anyway, and it's over. So there's ways to divert the attention, and not make that the focus. Now, if you have a relationship with this physician and you want to talk about what you're doing and say, listen, I really have been reading some or listening to a podcast or talking to a nutritionist or whatever. And I've learned a little bit about intuitive eating and health at every size. Are you familiar with any of that? Just ask without being interrogating, or, I really am working on my health outside of the context of weight. And I want to see if we can come up with all the solutions for this problem, without having weight be the answer. Because, if you're in a big body, weight is always the problem and weight loss is always the answer. Mm-hmm. I mean, that's how it works. So you deserve to hear the whole story, no matter what size body you're in.
And this whole conversation you had about confrontation is how you approach the conversation that is key in that circumstance. But what I like about what you taught for those 3 things you can do is that it's an equal relationship between the patient and the provider.
Right. And we want it, let me be honest, as a doctor, we want you to like us. We want you to be satisfied with your encounter. We want you to come back. We're not there to purpose. And I really do think most of the doctors that are weight stigmatizing their patients are not doing it maliciously. I want all the fat people out of my practice. I'm going to make them so mad they all leave. Nobody's actually like that. We care about your health and we want you to continue to participate in healthcare. The misunderstanding is that we think by telling you if you lose weight, your health will be better. That's where we lose you. We lose the credibility and we, kind of break that relationship. And the truth of it is the real big problem, like the public health problem, is that then you don't go back anywhere. You have such a bad experience with provider A, you don't just go find another doctor. You literally are just so put off by the whole thing, you don't go to any doctor. And then 10 years later, you come up and you have whatever problem. And who knows, it might have been prevented. It might have, and then this perpetuating cycle in medicine. So then what we do is we stigmatize the people in large body. They basically are marginalized out of the healthcare system completely because they're so put off and discriminated against. Traumatized. They don't go back. Then they resurface, like I said, 10, 15, 20 years later, and they've got breast cancer or diabetes or hypertension or whatever. And then we publish some paper that says, well, look, all the fat people got hypertension. I told you. And then we take the paper that's already got weight bias built in to the data that you can't really control for, and then we bring all the fat people in our office and beat them over the head with the paper that we wrote that was laid on the foundation of weight stigma. And we use that to stigmatize another,
generation.
Yeah. So it never stops.
So how is a coach, because I have faced that many times where when I onboard a client, we go through medical history, briefly, and then only to realize that they haven't seen a doctor in years, a physician,
I'm sure,
because of what we just spent the last 20 minutes talking about. And then part of my role, what I believe our role as coaches is to bring them back to be supervised by a medical practitioner, because that's not our job.
Correct.
That's not what we're trained for, but we need to help them go back. So how can we help a patient? What would be your advice on that to bring them back into the healthcare system to be helped in their health?
Right. Well, and that's exactly the right thing, Stephanie, because we want them to go back to somebody. Having them leave healthcare altogether is the worst possible outcome. There's no question that causes worse health problems in the population. So the first thing is, if there's a chance, they can find a weight inclusive, health at every size practitioner who sort of is branded that way. Now, there's not a lot, but there are increasing numbers. I will tell you that wasn't even a term that a doctor would have even heard of 10 years ago. But now there is a emerging population of providers that are incorporating those ideas. So if you happen to be lucky enough to find that, well, that would be the best case scenario, because then you're not going to have to fight at all.
Do you have resources as to where to find those? Sorry to interrupt.
Yeah. So there is, and I'm forgetting off the top of my head. I think is it hayescommunity.org or something? I'll get you it.
Can you? And I'll put it in the show notes,
yeah.
whatever
Now,
you find.
here's the problem is that I will tell you it's not comprehensive because I went in there just as a curiosity for my own sake. I'm in Texas. Texas is a huge state, by the way. I don't know if Canadians realize that Texas is like,
it's like a country.
It's like, well, we were our own country at one point and we're thinking about going back. So, but I put in this, repository of names, physician, Texas, and there was 2 people. So I believe there is probably more than that. I don't know that this is like the end all, but this is where social media gets helpful, is because there's like this network of people doing this work of varying backgrounds. Some are psychologists, some are dietitians, some are coaches, some are doctors, some are therapists, whatever. Like somebody knows somebody, and so put your feelers out to see what you can do. That's the first thing. But that being the minority of situations, yes. I mean, most people can't do that. So,
and I hear a lot of insurance issue. Like people are dictated by their insurance who they should see.
Well, that's true. A lot of people don't have a choice. They have a very limited choice, or they have to go to a specific clinic or so that being said, and of course that I'm saying all that with coming from a place of privilege. If you can pick your doctor off of a list, that is a pretty privileged position to be in. But okay, so here's the other thing. One thing that people don't think to do is have a conversation with the provider or somebody from the provider's office before you go. And that can be on a phone conversation or even on email. And, a lot of people hesitate to do that because they don't want to, quote, bother them, but it lets them respond and kind of process this without being like on the clock. Like, okay, I've got 10 minutes. I'm not ready for this big conversation and the doctor poo-pooing it. So you can, send an email or have a phone call with, it would be great if it was the doctor, but even if it's one of the nurses or the office manager or somebody, and say, listen, here's what I'm dealing with. I am coming to you to get care for blah, blah, blah. I have had many issues in the past with providers focusing on my weight and worried about my obesity, air quotes, or whatever. I am learning health at every size. I'm trying to learn about health outside the context of the scale. And I want to make sure that I'm going to be able to get that value or that result out of this interaction. Can you put a note in my chart? Could I speak to the doctor, or could I send the doctor an email, or could, whatever, just to open that line of conversation. And they will not respond. Okay, they will respond to some thoughtful conversation like that. So that's one way to sort of be proactive. And then, in the office, like we talked about, laying out your expectations, like first, it's okay to be the first one to talk and not wait to be asked all these questions. Because if they don't know you, especially if they don't know you, it's going to be the standard kind of closed-ended questions. And you have to understand from the doctor's perspective, they've got a zillion things that they have to focus on, so they're worried about your quote obesity. They're also worried to make sure that you have good sexual health and you're not being abused and you're not a drug addict and you're not this and all this stuff. And so in their head, unless you've pointed out that you have a specific concern about one thing, all those things are kind of like equal. And we have to get through all of it in this short amount of time. So you're allowed and encouraged to bring up your concerns. And to be honest, I know it feels kind of assertive, but it actually is extremely helpful to the doctor, because I want to know what distinguishes you as a patient and what is your specific concern and what is we want to get down to what is important as fast as possible, as much as you do. And so if you lead that conversation, that's actually helpful. And I think you will find a favorable response from the provider if you just start in and even say, You may notice that I declined the scale today because I've had a lot of issues with weight stigma from other providers, or I've had a lot of distraction in other encounters with my weight. And I'm here to talk about my back pain. And I really want to make sure that I get the full complement of solutions. I find the scale to be a distraction. You know what? You can say stuff like that that is not confrontational and aggressive. It's just a matter of fact. And I think more often than not, the provider will actually be glad to just be like, okay, we're not talking about that. You know, I can go weight stigmatize my next patient. I mean, it's just, I don't mean that, but it's okay to sort of take a leading role, because if you leave it hanging out there because of the weight stigma and the education and the bias and all this sort of stuff that's kind of built into the system and the provider and the education, it's probably going to be low-hanging fruit.
It's going to be on the hit list. They're going to go there.
Exactly. So you have permission to sort of take it off the list. And I think most people will find that their physician's very receptive to that. Because like I said, we want to talk about what's important to you. And we want you to continue to seek healthcare. We want you to continue to, you know, if you and I have this like animosity, the chance of you doing what I advise you to do is going to be so low. Like, we know that's not good. I mean, patient-centered healthcare is the preferred practice model now. 50 years ago, like you said, there's this deal, like a white male doctor in a white coat told you to do something and they say jump and you say how high? Yes, sir. Right?
Yes.
That's not really, I know that does happen some, but that's not what any of us are trying to do.
I think this is very good coaching for the coaches, because observationally, from having coached a lot of coaches, we have a bias that we think every doctor is out there to stigmatize patients.
Right.
Which is not the case.
No, and I think honestly, very few are.
There is some. However, it's not the majority. So if that's the approach we take with our client and we tell them that, it's not going to be supportive for our clients. We have to say, yes, it does exist, but there's also a number of other practitioners that, they're going to talk about it, but they're not out to get you.
Right. I will tell you that, in my opinion, most of the weight stigma in the clinical environment is born out of just ignorance. It is not malicious intent. And that's not an excuse, certainly, but it seems more palatable to like, okay, we can deal with that. Like, we can take control of this conversation. We can educate, we can inform, we can, like, there's a little more negotiation power than somebody who, like you said, is truly out to get you.
And I think that the other part that's really important for the coaches of what you taught us today is this notion of equality between the two parties in a relationship, and establishing consent or not consent to have the conversation about weight, declining the weighing or the taking your weight until it's needed. That will set the tone in the conversation between our client and the provider. And then initiating the conversation, being the leader in the conversation with our doctor.
Right.
That's tremendous.
Absolutely. And I want to bust a couple of myths real quick, if I can do so.
Go.
Because when I say these things to people, their jaw usually drops. Okay.
Yes.
First of all, weight is not clinically relevant for most health conditions that you are being seen for in it, especially in an outpatient situation. Okay. I mean, the number of health conditions that require a accurate today weight is like, I can probably count on one hand. Okay. And these are the outliers. Like, if you are on dialysis, if you're getting chemotherapy, if you're having general anesthesia.
Yeah.
Okay. I mean, so like, that is not why most people are in the doctor's office.
And just to precise for people that are new, they require weight because they have to modulate dosage on certain element that will come into the body.
Correct.
That's why weight is needed.
Right. And it has to be very specific, because there's a very narrow, what we call therapeutic window, so that the accidentally either underdosing or overdosing a patient can be very dangerous with anesthesia and chemotherapy and stuff like that.
And we can ask for blind weight.
Correct. Yes. Yes. So that's another choice where you turn around and they see it, but you don't see it.
Yeah.
Exactly. Okay. So, but that being said, 99.9% of people going to the doctor's office today are not going to get chemotherapy and general anesthesia and dialysis. They are going because of an infection or a whatever, mental health, whatever. Okay. Yeah. So that's the first thing to know, is that there's this idea that like, well, if let's just say I have a sore throat, and what if they give me antibiotics? Then they need to know my weight to give me antibiotics. No, ma'am, they do not in adults. Now in children, that's a different story, but in adults, it is the same dose. Okay. You get the same antibiotics for strep throat, whether you weigh 90 pounds or 290 pounds or 590 pounds. So you get the same medicine. People don't realize that. Honestly, I just think they think that it's like somehow different. It's not. The other thing that I wanted to say is that this urban legend, I'm not sure where this sort of comes from, that like they need to have it so that they can bill for the visit. Like they need it for their documentation. They need it for insurance. Yeah. You hear that, right? You've heard that.
I heard, yeah, totally.
Okay. Number one, I don't believe that to be true. They can write declined in the same little box, the same way that you decline the flu shot or decline getting a mammogram or whatever you've declined that we have recommended. That's fine. Okay. So I believe there are lots of ways to document a visit without having a weight on there. And the other part is, guess what? It's not your problem. Like as the patient, it's not your responsibility to make sure that the doctor's documentation meets the criteria for the insurance company. Who the hell cares? It's not your problem. Let them figure it out, or tell them, fine, just put my weight from last time, just whatever. If they're so obsessed with a number, just make something up. I mean, whatever, who cares? But the bigger idea is it's not your problem. And if that's really a problem for some insurance somewhere, then we have a problem with that system. Then we need to change that system, and that's not you as the patient's responsibility to comply with that. So I just wanted to put those two things out there, because those are the most common things I hear from people. Like, well, I feel like I have to because of, and that's usually the two things that they say because of. I might get a prescription, or the doctor can't bill my insurance.
Here's another one. This is something that I've coached clients for years on. I don't know what you think of this one, but when the conversation with the provider comes around to the weight, let's say you go in with a complaint of, I don't know, stomach pain, and the advice from the doctor is to lose weight, my comeback that I coach people on is to say, so if I wasn't in this weight range, if I was a patient in a straight size body, what would you tell me? That's Correct. What I want to hear today.
Correct. So like there is no disease that is exclusively found in large people. None, not one disease. So you deserve to get the full complement of potential diagnoses and solutions as they would give to anybody. Because you're exactly right. Because let me tell you what, the skinny person in the office with your same problem, the doctor is not standing there like shaking their head like, oh, I don't know. I have no ideas. There's no ideas. The only idea I have is weight loss, and you're already slender, so I have no idea. They're not saying that's preposterous. So there are answers that don't involve weight loss for any problem, even diabetes, even joint pain, even back pain, even reflux, even sleep apnea, all the things that are sort of pinned on weight. That is not the full answer. And if that's the only answer you're getting, you're not getting a complete answer.
So this is a great note for coaches to teach that answer back to the patient. But I want to go into, and we're going to close the interview on this difficulty that patients or client have with their provider. It has to do with the indoctrination and socialization that our clients in larger body have suffered for years and decades. And they have a disempowered mindset. And that shows up in the relationship with the provider. They're subdued. They are, whatever you say, I will obey and I will do, and I'll suffer through this. And I think the relationship with the provider can be an excellent platform to coach your client in becoming more empowered and using that platform to do that. What do you think?
Absolutely. Well, yeah, no, absolutely. Because, and I know that's true. And when you go to a doctor's office in a large body, you're already in a negative like mindset before you've even come in the front door, because you are conditioned of what to expect. And you know that you're going to have to deal with the scale, and you're going to have to tell them yes or no. And then they're going to tell you that your weight is the problem. And then it's going to, and the gown's not going to fit, and they're going to have to go find some other blood pressure cuff and all the issues. I mean, there's so much, even just in the physical space, that is adverse for patients in large bodies. Yeah, it is very common to just sort of be like, okay, I'm just going to sit here and be quiet and let them tell me whatever they're going to tell me, because I want to get the heck out of here.
Yes.
At ASAP, but that's not really the reason you're there. I mean, there's some reason you're going, because you have either a health problem, or you're trying to get some sort of preventative care or something. Nobody's going to the doctor's office just to go to the doctor's office. That nobody, not even the doctor. So, to make sure that you hang on to that reason. Okay. That is like your lifeline. Why are you there today? And that it always has to come back to that. It always has to come back to that. Like, no, I'm here to talk about this. No, this is what I want. This is the answer I want by the time I walk out this door. Like, that's the information, and it's like staying on a train track. Do not let them derail that mission.
When we talk about to our client, we are going to help you. We coach them to say, we're going to help you unlearn diet culture and learn to be back in your power. As a coach, these are the teaching situation, like coaching them through their medical providers visit is an environment for us to coach them on claiming back their power, and our client practicing being in their power.
Right. And here's the great thing is, it's not the patient's job to educate the doctor about weight stigma. However, you might just do it without knowing that you're doing it. You know what I mean? And if you even just open their eyes to the idea of how, that visit went a lot smoother. Like, I'm talking from the doctor's perspective, like that seemed like a happier patient. That seemed like a more positive interaction. That seemed okay. Like, I don't think I really missed out on the weight. I don't think, like, you have no idea what little seed you're planting that might affect thousands of other interactions with patients. And see, that's how we're going to, like I said, I'm not putting it on the people in large bodies to fix the system, but by advocating for yourself, you might inadvertently actually help fix the whole thing. And doctors are not, by and large, bad people. Okay. They are not, like we said earlier, they're not doing this on purpose. We want you to be in healthcare. We don't get the right education. We have personal biases, which are inexcusable. We just don't have a practice environment set up to have this conversation.
The system is broken with weight stigma.
So broken.
We don't not doing that, but how can we navigate through a broken system to the best outcome for the client?
Right, exactly. So the coaches that are listening that are going to be coaching people how to go to the doctor's office, that is really the deal, is that what is the purpose of this visit? And you hang on to that tight. And that's going to redirect the conversation. That gives you something kind of tangible as a talking point. And, just not to be derailed, and if you have the opportunity to be proactive in advance, like I said, that is very useful. But I tell my clients, like, I give them a scripting, like truly like words, because they go to my coaching program and they hear all this, but then they get kind of caught up in the moment when they're actually in the doctor's office. And so I have, truly like words, like this is what you can say out of your mouth. This is how to say no to the scale, literally the sentence to say. And sometimes you need that. And the first time, you may not continue to need that once you feel more empowered and you feel like you have more kind of autonomy in the situation. Yeah. But
I can tell you that, and having coached people on this, and this is where including mindset in your coaching practice is essential, because if you're only doing intuitive eating, none of that you'll be able to coach your client on, because you don't have the skill set to coach people on claiming back their power. So mindset is essential, because that's what's going to allow our client to take their space back in a system that's broken.
Yes. Yes. And hopefully, eventually, the system will not be as broken and it won't be as heavy lifting to do the work. But for the moment, it just is. So we just have to be honest about it. It is. And that's where we are.
And that's what, again, I'll say, this is what distinguishes activism versus coaching. When we coach, we are into that clients and getting them to take their space back in their power, where activism is the people that go out there and try to rebuild the system and create changes.
Right.
And that's different.
Very different. And it takes a different type of person and a different approach. And yeah, exactly. And if there are physicians like me who want to be activists, that's fantastic. That's going to move the needle much faster. But for the moment, I'm just asking providers to just not be part of the problem. Like if you could at least not be part of the problem, if you're not ready to be the solution, that's okay. I'm sort of okay with that if that's all the more you are, but like, please, pretty please don't make it worse. For those of us who are trying to.
So let's say that there is a provider listening right now, because I know there's a number of registered nurse and PAs that are following my work and trying to integrate. What would be their first step?
Well, to do some of that independent learning, because I promise you, I don't think this kind of stuff, this mindset work, the understanding of weight inclusion and health at every size is not part of what you learned in your formative education. I mean, I can almost say that with certainty. And it starts with simple stuff. It starts by listening to like podcasts. It starts by reading books. It starts by following people on social media or whatever, just curating your environment so that you realize this is not just a couple of random randos out here.
There's this other side of medical approach.
Right. And you can go as deep as you want, because as far as I know, this is where the evidence is. I mean, you can go to PubMed and go to the scientific literature, and these ideas are supported there. So it's not just some sort of like fringe idea with like some crazy person on Instagram. I mean, this is a real thing. And if you're not aware of it, you should become aware of it and start doing some of that independent study, because we have to understand. And I don't blame you. If you went to nursing school or medical school or whatever, 20, 30, 40 years ago, this wasn't really a conversation at all. So that's okay. You can't blame yourself for that. But we have to understand that science evolves and our knowledge evolves, and sort of the things we know, the best practices have evolved. And we need to accept that in terms of nutrition and weight stigma, as well as we do with surgical equipment and antibiotics and all the other things that we totally understand change. That is still an enigma to me, like why this is sort of excluded from that scientific progress. It's just sort of like some dude publishes a paper in 1950 and then we're like, okay.
Well, I think this is a whole political conversation.
Yeah, that's a whole other podcast.
Well, there's a lot of money that wants to hold to fat phobia in the medical world. Well, we won't talk about that. That'll be conversation number 2 with Maggie.
Correct. That's part 2. See, that's the teaser, the cliffhanger.
So where can people find you and how can they get into your world, Maggie?
Well, exactly. So the easiest way to find me, I'm Maggie Landis, MD, and that is my website, maggielandismd.com. And that's where I am on social media. I'm most active on Instagram and Facebook. And I have a free Facebook group that I run for women that are interested in talking about this. And I'd be happy to have anybody from your audience that fits that bill to join me.
Perfect. So all of that will be linked in the show note, as well as the resources you were mentioning. Yes. And if I find more, I will add them to the show note as well. It was a pleasure talking to you. And I know this conversation is going to help a lot of coaches create a narrative for their clients' conversation.
Yes. Well, thank you for having me, Steph. I love the work you're doing. And I know this will change a lot of lives. So thank you.
We are very proud to announce the Undiet Your Coaching Practice Scholarship Program for self-identified fat and BIPOC people looking to grow their non-diet businesses. We acknowledge a gross underrepresentation of fat and BIPOC people in the non-diet industry, and we believe one of the primary key in making the non-diet approach accessible to all is by encouraging diversity in size, race, ethnicity, and culture among non-diet coaches and non-diet health and mental health practitioner and all non-diet business owner. So we are announcing 2 scholarships applicable to the next round of our non-diet mentorship program that will kick off in January 2022. Application for the scholarship will be accepted until October 30th, 2021. You can find the detail at www.stephaniedozier.com/scholarship or use the link in the show notes. And I'll see you on the other side. Ready to shed diet culture from your practice and help more clients do the same? Awesome. We've got free resources to get you started. Simply go to stephaniedozier.com/pro series, all in one word, and access our 3 free training classes that are currently available. We also have a free PDF guide to intuitive eating, an article about the non-diet approach. We also offer a variety of paid programs throughout the year to support you in your journey to undiet your coaching practice. Join us at stephaniedozier.com/pro series, and I'll see you on the other side.